Lindsay Musgrove. A lot of benefits for both mother and baby. For the mother, you can start forming a routine with your baby.
Duxbury mother accused of killing her 3 children and trying to end her life is permanently paralyzed. Lindsay Clancy's defense attorneys say she cannot move from the waist down, and she never will. She was injured when she jumped out a second-floor window after allegedly strangling her children in January. Clancy is now at Duxbury Hospital for medical and psychiatric.
In Duxbury, Massachusetts, a community grappled with a heartbreaking and complex case involving the Clancy family. Lindsay Clancy, a 32-year-old mother, faced charges related to the deaths of her 3 young children. On January 24th, tragedy struck the quiet town. Amidst concerns about Lindsay's mental health and struggles with postpartum depression, an unthinkable event unfolded within the Clancy home. Medical reports indicated she was taking antidepressants and antipsychotic medications, raising questions about the role of mental health in this tragedy. The critical moments.
January murder and strangulation of her 3 children in their Duxbury home. The defense says she was acting like a zombie due to her medications and postpartum depression. The prosecution described Clancy's actions as deliberate and premeditated.
She finished strangling the children, returned her husband's phone call, then went up to the bedroom on the 2nd floor. There she used the knife to inflict superficial cuts and scratches to her wrist and neck. She took the remaining pills of the Remeron and Seroquel, and then she climbed out of the bedroom window and gripped the windowsill while dangling from it.
Patrick Clancy, Lindsay's husband, called emergency services reporting a possible suicide attempt by Lindsay. Upon arrival, responders found her injured. The true horror emerged in the basement, where their children, Cora, Dawson, and Callan, were found unresponsive with exercise bands around their necks. Despite valiant efforts by medical personnel, Cora and Dawson tragically passed away. Young Callan succumbed to his injuries days later. Lindsay's legal maze. A month later, Lindsay Clancy, still hospitalized, faced arraignment on 3 counts of murder and strangulation. Her lawyer emphasized her battle with postpartum depression and its potential impact on her actions. Court documents revealed glimpses into Lindsay's internal struggles, including personal notes expressing difficult emotions and concerns about her own mental state. The complexities of mental health.
There are 11 search warrants laid out in hundreds of pages here that document exactly what investigators have seized as evidence, including journals that Clancy allegedly wrote herself. Her attorney says she was overly medicated, suffering from severe mental illness. 11 search warrants allowed investigators to collect evidence from the house, perform forensic searches of cell phones, tablets, and laptops, also collect Clancy's blood and urine after the killings, as well as swabs of saliva, hair, and clothing.
Conflicting assessments from different medical facilities regarding Lindsay's mental health added to the case's complexity. Despite reports of postpartum depression, one hospital concluded she didn't meet the diagnostic criteria. However, her earlier admission to McLean Hospital indicated an awareness of her own deteriorating mental state.
And this family, as I said earlier, was on a road to hell, and unfortunately, they're not coming back.
A stunning development from a new attorney for Lindsay Clancy, who claims she was over-medicated in the months before she allegedly killed her 3 children and can't be held criminally responsible, what he wants a jury to hear.
Her husband actually went to the doctor the week before and asked for help and said, you know, you're turning her into a zombie. And it was just a brutal, brutal existence that they were living.
The present and future of Lindsay Clancy. Currently, Lindsay Clancy resides at Duxbury State Hospital, receiving mental health care. The legal process continues, with a formal indictment and plea yet to be determined. This case has prompted crucial discussions about mental health, particularly postpartum depression, and the need for accessible and appropriate support systems.
Thanks for watching. Like, comment, subscribe.